Mental health in pregnancy. The process of entering motherhood is highly stressful for women, with 15 to 85% of new mothers experiencing postpartum blues or depression. A study was conducted by a group of researchers in 2019, designed to evaluate the efficacy of a mindfulness-based childbirth and parenting program in improving psychological health during the postpartum period. This research was a randomized controlled trial with single blinding. Recruitment began after the participating hospital granted formal approval. 74 women between 13 and 28 weeks gestation were allocated either to the intervention group or the comparison group. The intervention program included a series of 8 3-hour classes held once weekly and 1 day of 7-hour silent meditation. Psychological health was assessed at baseline and 3 months postpartum. Significant differences in stress and depression were observed in both groups over time. Stress scores and depression scores were significantly better in the intervention group than in the comparison group at 3 months postpartum. This study concludes that the intervention program effectively reduced postpartum self-perceived stress and depression, suggesting that this program provides acceptable and long-term benefits to women during pregnancy and the postpartum period. The teaching and practice of mindfulness meditation and parenting education during pregnancy may help reduce stress and depression in pregnant women as they transition into parenthood. Despite the potential for benefit, mindfulness remains an emergent area in perinatal mental health care, and evidence of smartphone-based mindfulness training for perinatal depression is especially limited. A randomized control trial was conducted in 2021 to evaluate the effectiveness of a smartphone-based mindfulness training intervention during pregnancy on perinatal depression and other mental health problems with a randomized controlled design. Pregnant adult women who were potentially at risk of perinatal depression were recruited from an obstetrics clinic and randomized to a self-guided 8-week smartphone-based mindfulness training during pregnancy group or attention control group. Mental health indicators were surveyed over 5 time points through the postpartum period by online self-assessment. The assessor who collected the follow-up data was blind to the assignment. The primary outcome was depression as measured by symptoms, and secondary outcomes were anxiety, stress, affect, sleep, fatigue, memory, and fear. A total of 168 participants were randomly allocated to the mindfulness training or attention control group. Mindfulness training participants reported significant improvement in depression compared to attention control group participants. Medium between group effect sizes were found on depression and positive affect at post-intervention, and on anxiety in late pregnancy. Mindfulness training participants reported a decreased risk of positive depressive symptoms, Edinburgh Postnatal Depression Scale EPDS score 9. Parity did not show a significant moderating effect, however. For nulliparous women, mindfulness training participants had significantly improved depression symptoms compared to nulliparous attention control group participants. The study concludes that smartphone-based mindfulness training is an effective intervention in improving maternal perinatal depression for those who are potentially at risk of perinatal depression in early pregnancy. Nulliparous women are a promising subgroup who may benefit more from mindfulness training.